What's up guys, welcome to another video of the MD Journey. My name is Laksh. My job is to help you succeed in med school with less stress. In this video, this is probably the most important video I've made this far, where I teach you not how to study, not how to manage your time, I've done those in previous videos, but how to build strong relationships with your patients. If you learn how to do this well, you will separate yourself from the pack. I'll put a few screenshots and snippets of the evaluations I've had, and most of them always include something about what my patients thought of me. And they were willing enough to tell my attending, and those are going to end up on my dean's letters, all my different evaluations, and residencies will see this. So it's a skill that served me really well, and I want to teach you guys in this video how to really define your patient experience, how to make sure that you have strong patient interactions, and hopefully using these tools and your prior experience and just some practice, you guys will be able to definitely separate yourself from the pack. So before we get to the video, intro. So as I mentioned in the intro, we're going to talk about building strong relationships with our patients. But before I do, I just want to quickly thank all the new subscribers that have joined the MD Journey channel since I went on my Step 2 hiatus. I know I haven't been able to introduce myself to a lot of you, so really quickly, my name is Laksh. I'm a third-year medical student. I'm about to be a fourth-year med student. And I've had a blog called mdjourney.com for the last 2 years where I've been writing about tips and tricks for med school. And now I'm taking those tips and converting them into video form. So again, welcome to the channel. If you definitely want more info, just check out the mdjourney.com. There'll be the link in the description, but let's get to the video. So how do you build strong relationships? So the first thing, and it's really obvious, but there's a trick and a trade of how you do this, is you have to make sure the patient knows you care. Everyone in a hospital cares about improving the health of the patient. That's why we're all there. But sometimes the patient doesn't know who we are and what our role is. So make sure the patient knows, one, who you are, and two, what your role is in taking care of them and caring for them. So there's a quick and a very effective phrase that I like to use, and I know I've mentioned this in my video about the top tips for your clinical rotation. I'll link that up here in a card, but it's a phrase that goes something around the end of your interview or your conversation that just says, again, my name is Laksh. I'm the medical student on the team, which means that I will have the most time likely to spend with you. So if you have any questions that I can answer, anything I can do to help better take care of you, please let me know and don't hesitate. Again, my name is Laksh. You have to understand that is such a powerful phrase for your patients because they're just so used to having people go in and out of their room without really any introduction. They don't really know what their roles are. And to have somebody, a medical student nonetheless, tell them that I'm here for you, here's my role, and I care for you, that's going to make a huge impact. On all those evaluations, those snippets that I put up earlier, it's really about the patient knowing my name and knowing that I care from them for the very first interaction we had. And then using the tips that we're going to go over the rest of the video, they just have a great patient experience, at least with you. And often that ends up in your evaluation. They tell your attendings, they tell your residents. And that's worked really well for me. Obviously, I'm not doing this to be fake. I really care about my patients and I want them to know that. But this is a really effective tool on making sure that sometimes that message comes across on your evals. So now your patient knows you care. So the second thing to really define a strong relationship is just to know everything medically that you possibly can about your patient. So that includes obviously their history, their chief complaint, what they come in with, but also their chronic history. Do they have heart failure? Do they have diabetes? Do they have asthma? And if they have any of those things, what do they use at home to treat them? Also know things such as like their lab values and their imaging. I'll link down in the description for a blog post as well as a PDF to what I call a scut sheet. It basically allows you to put multiple days of information for one single patient. So that way you can see their blood pressures over several days, you can see like their creatinine, you can see different labs that your team may be following for a particular patient. That way if your attending asks you, what was the creatinine of this patient when they first came in, you have it on one piece of paper. So again, I'll link that in the description with the corresponding blog post. That way you guys know how to use it. Hopefully that's helpful. But the big idea is just know as much as you possibly can, along with their history, along with their labs and imaging. Make sure you understand their plan. Because again, you're going to be the one going in the morning often before the resident does, the attending does, and they may be asking you what's going to go on with their healthcare regarding that day. And if you aren't really sure what's going on with your patient and aren't familiar with what your team has talked about the day prior, then you're not going to look very confident. The patient's not going to have much confidence in you. So know their plan, know their history, and then know their labs and imaging finding more for your team versus the patient, but you're able to take care of your patient at the bedside as well as alongside your team who's And if you know the patient better than the resident, better than the attending, and sometimes better even than the patient themselves, you know their healthcare better than they do, everyone involved will just know that you care for this patient and you will just have a much better experience, so will they. And ideally it comes over to your evaluations. Again, that's not the most important thing. If you do the right thing and you work hard overall, and most likely it's bound to reflect on your grade. So just keep these in mind. So a quick intermission before we get to the rest of the tips. I just wanted to show you guys something. So hopefully you guys can see this, but this cup right here says, "Thanks, a latte." This was given to me by a patient of mine during my surgery rotation that was there for 4 to 5 weeks getting routine surgeries on her condition that she had. She had gave me this cup as a thank you for all the time that we had spent together talking about her healthcare, answering her questions, and just about life in general. She was very nervous about all these procedures. Having to do a few surgeries a week was very nerve-wracking to her. So this interaction that we had using the tips that I'm showing you guys in this video, you know, it was probably one of my first experiences in med school where I can say, you know, like I made a difference. And so every time I look at this cup, I remember that. And so every day I try to look at this cup, go to my rotation with that same motivation that I had with that patient, because you can never know whose lives you would change. She wrote a really nice note that sits on my desk every single day. And I'm not saying that you should try to get a note or a thank you note or some type of gift from your patient. I didn't ask for this, but it's definitely a token that I can use as a reminder to continue to do what I'm doing and get better at what really matters, which is taking care of my patients and doing it at a high level. So let's get back to the tips. I just wanted to show you guys as kind of a sense of motivation. So now your patient knows that you care for them. The team knows that you're really in tune with what's going on with the patient regarding their care. So the third thing is to call the patient by their first name. Remember that most of these patients aren't sick all the time and they're used to people just calling them Jim or Bill or Sally and not Mr. Smith, Mr. Thompson. And you go in a room, yes, it's professional, but they're just not used to that level of formality, and it just creates another barrier of anxiety. So if you can go in and the patient, as long as they're not like an elderly patient, which I like to still call them by their last names, you can go in and be like, "Hey Jim, how are you feeling today?" They feel like they're talking to you one-on-one versus the care provider versus the patient themselves. So try to call them by their first names, and also make sure if your patient has a very difficult name, learn how to say it. Make sure the patient validates that you're saying it correctly, and then teach the rest of your teammates. It's just another barrier you get out of the way, and the patient feels much more comfortable once they feel like everyone kind of knows how to say their name, introduce them by their first name. A lot of this is just comfort. The patient feels much better throughout the duration of the visit or the hospital stay. So the fourth thing to remember to build really strong relationships with your patients is to understand that your patient is more than their past medical history. Often patients have a very vague idea of what they have. They may know that they have diabetes, have no clue what medications they take, and sometimes we focus on a lot of the questions that the patient really just doesn't have interest of or knowledge of. But they feel like maybe they're not being asked enough questions about themselves or their symptoms. So understand you understand as many aspects of your patient, such as what do they do for a living, you know, who do they live with, what recent stressors do they have, if it's important to their healthcare, obviously. Because sometimes if they're hospitalized for a long period of time, that can add an extra level of stress when they can't go to work, can't provide for their family. So just make sure you understand these little nuances of patient care. This may be able to help you guide conversations, especially if the patient's agitated, angry. If you already kind of know what the patient is stressed out about prior to their hospitalization, it'll be much easier for you to be able to deal with those and have conversations with them instead of something just popping out randomly. And this is a really important message for a lot of you new clinical students is you just don't know what healthcare questions to ask yet. You're not that well versed in their medical knowledge because you still have to get the experience. So know more about them than just their past medical history, because their past medical history may seem like a new language to you. So know what do they do for a living, you know, what their hobbies are, who they live with. A lot of these questions, just learn one thing that's new about them every single day. They feel like you're getting to know them outside of just their health problems, and your interaction with them is just going to be much smoother. The last two are probably the most important. One is you need to make sure that as soon as you have information and your team allows you to disclose that information to your patient, that the patient gets that info. I had an experience when I was at a VA hospital and I had a veteran who most likely had lung cancer pushing on his spine. But we weren't sure, it required a lot of testing, a lot of waiting for pathology results, imaging results, and it was just a lot of period of time with uncertainty. And so you can expect and imagine appropriately that when you go in every morning the patient and his wife and his kids would want to know, do we have any new results? And often the answer would be no. And while that may be disappointing to them to have to wait another day or several hours to get info, the best thing you can do for your patients to comfort them and at least trust you is just saying that as soon as I know something, so will you. So as soon as I found out the results of like a biopsy, lab test, as long as my attending was okay with me disclosing them and it wasn't a very sensitive conversation, I went down, stopped and dropped all my work and made sure that that patient understood what that new information was and what it meant. This means a lot to patients because, again, it makes them feel like you value their time, you would value their concern. You're not waiting several hours after you got a lab result to finally explain to them what's going on. And the last thing, it's 3 parts, but it's one idea, which is to remain calm. Your most valuable patient experiences are often going to be the patients that are the most difficult to deal with. And I had a few during my internal medicine rotation where it was a patient that really no one wanted to talk to, but at the same time, the patient wasn't receiving the best care just because everyone was trying to leave the room as soon as possible, just because the patient's demeanor wasn't very approachable, and it made it very difficult to take care of them. But those can be your biggest challenges, and if you can master how to deal with these patients, now I'm not going to say that I'm an expert, you can really just shine on your rotation, because if the patient that's the most difficult on the service says that they love you as the med student taking care of them, that's going to speak volume to your attendings and your residents. And so dealing with these patients requires, on that one tip, is to remain calm. And this is not only for the difficult patient, it's really for anybody. If a patient's angry at you, sad, frustrated, agitated, you really have to understand where those emotions come from. Make sure you're communicating not only about their healthcare, but just their total understanding of what's going on. Because if they're nervous, if they're scared, if you knew that prior to a procedure or a lab test or an imaging, if your patient's claustrophobic and they're about to have an MRI, it's valuable if you knew that information before they actually went to the procedure versus them being anxious in the actual imaging room. So just knowing these little things can definitely help you manage different frustrations a patient may have. But let's say that they still are agitated or frustrated, angry or sad, whatever type of emotion, just remaining calm and just understanding, communicating with them to try to figure out the source, saying you understand, apologize for anything you can, and give them a solution as long as you have one, or tell them that you'll check back and you'll give them an update on their issue and let them know that it's a concern of yours and you'll make sure you handle it as fast as possible. And so it's really the idea of just trying to maintain some sense of fake confidence. In your mind you may be freaking out, but just outside you look calm and your patient just reacts to that a lot better versus you also looking like you don't want to be there. And so the second part of remaining calm and building a strong relationship is understanding the Superman phenomenon. So I don't know how many of you guys have heard this, but it's the idea that a lot of our patients are the head of their household, the primary income, involved a lot with taking care of their kids, another sick family member. And so being in the hospital sick themselves is very stressful to their lives and likely also very stressful for the rest of their family. And so sometimes the person that does the most in the family feels like they're invincible, and now that they have something that they have to deal with themselves, you have to remind them that you know that they're used to being Superman or Superwoman in their life, but this is a time where it's okay to rely on other people to take care of them. And the third part of remaining calm is kind of similar, is that if a patient is agitated, angry at you and starts apologizing, or if they're sobbing but they're not sure why and they're apologizing for that, one phrase that I love to use with my patients is that it's my job to take care of you and not the other way around. That just speaks volume again because it tells the patient that I'm there for you, let me take care of you, and then ideally get you back to your normal life so that way you can be the Superman or Superwoman that you were for somebody else. All of these tips, guys, combine them together, put them into practice, make sure you obviously listen to your patients, make sure you know them well inside and outside of their medical history as well, and you will just make a big impact on the majority of your patients. People will see this, you will enjoy your medical experience, your clinical rotations much. I can still look back to every single rotation and think about a patient that I had difficult or very fun to get along with that just made a huge impact on me. And I know that the lessons that I learned through those interactions are going to help me with my future patients. So definitely value your patient interaction. Your patients don't exactly grade you, but they do. They'll tell your attending how they feel about you one way or the other. So make sure you do everything in your power to take care of them, and hopefully that will show on your evals, your grades, and you'll just be much more motivated in med school to show up to work the next day, because you get to make that kind of impact on somebody else. So hopefully that was helpful. If so, let me know in the comments below. Hit a like to this video. Again, if you guys have any questions whatsoever in med school, please let me know in the comments. You can email me at themdjourney.com, @gmail.com. I'll link that in the description. More videos about med school coming out on a weekly basis. So if you haven't subscribed, I don't know what you're waiting for, but hit that subscribe button. Support the channel. I'm putting out new videos on a weekly basis every single Wednesday. Again, thank you guys so much for watching. This has been a really fun experience the last couple of months putting these videos out. So thank you all for that have been commenting, just letting me know that these have been helpful. It motivates me to put out more. But again, thank you guys so much for watching. I'll see you guys next week in the video. But take care, guys.